Good morning everyone. I am Dr. Ashish Kharel from BP Koirala Memorial Cancer Hospital, and today I will be doing a short presentation on chest tube drainage systems. And these tubes are used for drainage of the pleural space in a variety of cases, most commonly being a pneumothorax, a hemothorax, various etiologies of pleural effusion, empyema, and post-operatively after thoracic surgery, which is the most common indication in our setting. And these tubes are usually connected to various types of drainage systems, and these drainage systems vary and have evolved throughout the years to be more complex and more advantageous to remove the collections. And the aim of an adequate chest drainage system to be fulfilled are to remove the fluid and air as promptly as possible, prevent drained air and fluid from returning to the pleural space, and restore negative pressure in the pleural space to re-expand the lung. Thus, a drainage device must allow air and fluid to leave the chest. It should contain a one-way valve to prevent air and fluid returning to the chest, and have a design so that the device is below the level of the chest for gravity drainage. So, in conclusion, the key components of a chest tube drainage system includes a chest tube, which is inserted in the pleural space and drains the fluid from the pleural space to the collection system, a drainage collection unit which collects fluids and air, and there should be a one-way valve to prevent backflow. There should be a suction mechanism which, if required, enhances the drainage, and gravity drainage is also required and is essential for function, as fluid moves from a place of high pressure to low pressure. So today we will be focusing on the types of the drainage systems and how they work. So the most common classification is according to the number of compartments, which include a one bottle drainage system, which is the most primitive type, then two bottle drainage systems, and three bottle drainage system. So the picture shows, so in a one bottle drainage system, the same drainage system, the same bottle is used both to drain the fluid, to maintain the valve, that is to maintain the water fluid level, and if required to maintain a negative pressure. If negative pressure is not used, then a vent is required to maintain the atmospheric pressure in the system. Then a two bottle drainage system, in this there are two compartments. The first compartment is the water seal and drainage bottle, and the second compartment is used for suction. Whereas in a three bottle drainage system, both the drainage, water seal, and the suction are separate. So this is the classical one bottle drainage system that we use in our institute. Although it looks like it has two compartments, but it is a single compartment communicated by here, and so a single chamber is there for both drainage and water seal, and air exits through the water seal, fluid accumulates in the chamber, and the limitations are that it is inefficient for large drainage, and there is always a risk of backflow to the chest. So what we should be mindful is the air fluid level should be at least 3 to 5 centimeter. If it is less, then again there may be an inefficient valve, and air may enter into the thoracic cavity. Whereas if it is more, if the air fluid level is a lot more, then there will be inefficient drainage of either pneumothorax or the collections into the bottle. This is because it requires a larger force to come down from the chest to the bottle if there is a large air fluid level. Then there are two bottle drainage systems. Because of the inefficiencies of the one bottle drainage system, this was used, and this was developed, and here suction can be done using a separate bottle. This because the suction is also a wet type of suction with the negative suction causing the air fluid level, a negative air fluid level. So we can control the suction using the air fluid level from the second bottle. And in the first bottle, there is the water seal is there, which prevents the air going back into the chest cavity, and in the first bottle itself the drainage also occurs. So this also relies on gravity drainage, and this is useful. This system is useful for drainage of a large fluid volume, as there will always be the maintenance of a low small size of air fluid level. And of course we can use a controlled suction, which is not very possible in the single bottle drainage system. Then there is a 3 bottle drainage system. Here the drainage occurs in one bottle, then water seal is there in the another bottle, and finally suction control bottle is in the third bottle. So by separating the drainage and the water seal systems, we can enhance the air or fluid removal, as there won't be the need for the air to or the fluid to overcome the air fluid level in the water seal. So it is very useful to manage air leaks and for efficient lung re-expansion. Then after this, the bottle systems can also be classified according to the seal type. The classical system is the wet seal type, where the air fluid column, the water column is used as a one-way seal valve. So when the patient coughs or breathes, or there is increased pressure in the pleural cavity, which can overcome the air fluid level, then the air will escape, but it will not let the air re-enter into the pleural cavity. And the other is a dry seal system, which is a mechanical seal, where is a one-way flutter type of valve leads to easy leakage of the fluid or air in one direction, but prevents re-entry into the chest. So what are the difference between a dry seal and a wet seal? So dry seal drainage, the prevention of secondary pneumothorax is high in the dry seal type, whereas it is only moderate in the wet seal. This is because if there is tipping over of the air fluid column, then the patient will develop pneumothorax in the wet seal drainage. But there is no requirement of fluid column maintenance in the dry seal, so the secondary pneumothorax is prevented more in the dry seal. Then again obstruction, because if the air fluid column is very large in the wet seal drainage, then there will be difficulty to remove the collections from the chest, and a large amount of force is required to remove the collections, whereas in a dry seal only less force is required to remove the collections. So again obstructions chance is less in the dry seal. Then the liquid drainage capacity is better for less viscous liquids in the dry seal, as because of the flutter valve, more viscous fluids may not be able to pass through the flutter valve, whereas in a wet seal both it is efficient to remove the large volumes, and even dense liquids can be removed. And Visualization of the drain quality, the fluid quality is higher in the wet seal drainage, whereas it is low in the dry seal drainage. Similarly, the maintenance cost is lower in the dry seal, whereas it is moderate to high in the wet seal, and overall cost is also lower in the dry seal drainage system, whereas it is slightly higher in the wet seal. So dry seal drainage overall is a less complex but more efficient system if we have to remove the pneumothorax or serous collections, whereas wet seal drainage is more efficient to remove viscous fluids or if there is blood, because we can see the quality of the effluent. Then according to the use of suction, we can classify the drainage systems. There are two types of suction systems. One is the wet suction and the other is the dry suction. Again, wet suction is the classical system and negative suction is applied to a water chamber, and which regulates the amount of suction by height of the column of water in the suction control chamber. And suction pressure of minus 20 centimeter of water is usually the most commonly recommended setting. Whereas in dry suction, the suction is maintained by a self-compensating regulator where an air fluid level is not required. And here, to set the suction setting, a dial with a diaphragm is rotated and which prescribes the suction level. For dry suction also, a minimum of 16 liters per minute airflow is required from the main suction valve. So these are the two different types of suction. We have used both these systems in our center previously. Previously we used to use the wet suction system where the negative pressure was maintained by the water seal, and the disadvantage of this one was that if we have to use for few days, because of the negative suction, water would evaporate from the system and we would have to intermittently add water to maintain the efficient negative suction. And another disadvantage is that if the system is knocked over, then water can go into the other chambers, and again this will lead to the decrease in the efficiency of the negative suction. Whereas in dry suction, it is a silent system and bubbling does not occur normally, so we can use a wider range of suction levels. It is quieter. As we don't need to put water in the system, it has a faster setup and is more easily managed in the ward by the nursing staff and the lay persons. So another thing that has been incorporated into the modern drainage system are the air leak meters. These are proprietary meters which incorporate the air leak meters as a way to measure the air leak and monitor changes over time. Although it is not exactly objective and mostly it is subjective and does not have a basis of a pure mechanical basis, but the volume of the fluid that is leaking from the chest cavity into the collection chamber can be measured, and various systems divide this meter either from 1 to 4 or 1 to 5, some divide it up to 1 to 7, and the higher the number of numbered column through which the bubbling occurs, the greater is the degree of air leak. So if air leak is only less, then the water bubble may come only up to level 1 or level 2. If there is a higher amount of air leak, then the bubbles will come up to farther to the higher numbered levels, up to 4 or 5, and this is a subjective or a slightly objective way to measure the volume of air leak and to see changes throughout the patient's hospital stay. So this is also a way to document the air leak and an objective method to measure an increase or decrease of the air leak. So this was the system that we had used previously in our unit. This was a wet suction and a wet seal system. Here this is a 3-chambered system. First the air and fluid from the patient goes into the collection chamber. These collection chamber may be either 2 or 3 chamber, or may also be a single chamber, and these chambers have markings for measuring the fluid that has been evacuated from the chamber. And this chamber may either be a small volume of a mini drainage system of less than 50 ml to they may be even a large volume of up to 2500 ml. Then the air leaks, and there is an air leak gauge and a underwater seal drainage system. This is the second chamber. If there is an air leak, the bubbling will occur at this site, and we can see the volume and the level, the amount of air leak that is occurring. Also, this is the water seal chamber, which prevents air going back into the chest cavity because of the water seal. And finally, the third chamber is the negative the negative suction system. Here the suction regulation is done by the wet system, by the column of the water. An atmospheric vent is also required, and a wall suction goes here, which pulls the air, which pulls the water column upward, and the amount of the water column that is higher than the atmospheric vent is the negative pressure that is being applied to the chest. So this is the newer type of underwater seal drain that we are being using in our center. This is a dry suction, dry seal type of system, the SYNAPI chest drain. Here there is a one-way flutter valve that is that functions as a one-way valve, and so that there is no air entry into the chest cavity, but because the valve is a one-way system, the air and water from the chest can easily go into the collecting chamber, but there will be no air going into the chest wall, and we don't require any type of any type of water column to maintain this system. Also, the negative system, the negative suction is applied from here, and there is a regulator which controls the volume of negative suction that can be applied and to the patient. Then there is the Heimlich valve, which is a one-way flutter valve within the rigid plastic tube for outpatient use. If the patient has a prolonged air leak without large volume of fluid coming out from the chest tube, from the chest cavity, then this Heimlich valve can be used in an outpatient setting. Again, this is a type of flutter valve covered in a plastic tube so that air and fluid can escape into the atmosphere, but the atmospheric air cannot enter into the chest tube. Then there are various newer modalities which are the digital drainage systems. Although we do not use these systems in our center, here the digital devices they measure the volume of air leaking through these systems, and they also measure the volume of fluid that are going that is escaping from the chest cavity, and also they have an automatic suction regulation, and they can give the real-time alerts to the nursing and physician staff to measure the quality and the volume of the drainage. So the benefits of this system is that it has shorter hospital stays, and accurate data can be taken both of air leaks and the fluid drainage. And as these are battery operated, the patient has a better mobility in the hospital stay. Thank you.
Thank you, Dr. Ashish. So, few things he mentioned lastly about the digital systems. So, I think the systems that he has mentioned by evolution, that were the simple, the glass bottles that we used before. When we started in our hospital also, we started with the simple bag, and I say that the first thing, we should never use the simple like urine bag or urine bag collection, because it will, you don't know, sometimes you will evacuate, sometimes the water will spill out of the bag, sometimes it will get punctured, so there are the high chances of the pneumothorax. So therefore I think that bag should be condemned, and the simple like urine bag, underwater saline bag. The next comes the bottle system. So that's very good. We have got the plastic bottle system. It works very good. When we did not have, we had the glass bottle systems devised by ourselves. He has shown a very nice pictures. We did also. We made from the suction bottle. We made the 3-chamber system. When we did not have this ready-made प्ल्युरो ब्याग जुन हामीसँग अहिले एभाइलेबल छ, हामीसँग थिएन एभाइलेबल, त्यो historical जानेको स्टोरलाई थाहा होला. So we used the 3 bottles and we made ourselves, our carpenters made it, and we used the suction system. So there is now, right now, it's very good. So it depends upon the indication, which kind of the bottle you are using, which kind of the device you are using. It's just only to drain in simple cases, this one bottle system will be enough. I mean, just simply the underwater seed bottle along with the accompanying the drainage system will be enough, that he has shown in the picture, just for underwater seed. If you require the suction, then definitely the 3-bottle system, the compact system, will be the best option. And I guess the wet system is cheaper, so wet system is generally being used everywhere, right? So right now we have been using with the dry system. I personally believe that dry system is very good from the point of view of the nursing care and also from the point of view of the patient, because there is no fear of getting the water or fluid evacuated from the bottle. Sometimes happens. To say it's they were to door say something pneumothorax will happen or something wrong will happen. It's not there. And it's less problematic for the sisters also to take care about. Lastly, he mentioned about the digital system. So I think a lot of questions may be asked. This time, Sasank was asked about the drainage bottles system. How many types of the suction bottles do you know? Then he said that similarly, and the question was, do you know the digital systems? He said, yes, I have not seen, but I have read about it. So in few words, he just mentioned what's the digital system. So I think this digital system, the main thing is that you don't need to connect with the suction, wall suction. You don't require the walls every time to check it. It's very comfortable. The second thing, we always mention that the chest bottles should remain below the level of the heart. You have to place on the ground or in the bed, right? So that it is below the level of the heart level, so that nothing comes out. Right? But this digital system, you don't require, you don't care about where do you place it. You can put it over the bed. You can just like hang it somewhere, like the monitors you can hang it. It's very comfortable. Patient can walk with the digital suction anywhere. And the suction is inbuilt. It is by the battery power, so you can, everything is inside. The very important next thing is that it has got the USB device and alert system. So everything can be seen in the screen. There is the screen with the alert. If something goes wrong, the alert will be there, the alarm will be there. And everything, all the patterns, all the parameters may be recorded into the USB, and that you can use for the research purposes. Another very important thing is that the grading, the amount of the suction that you apply, you can set the amount of suction level like -20, -30, whichever suction you require, and you don't need to care about that later on. Now, the grading of the air leak, as you showed here, the 1 grade, 2nd grade, 3rd, 4th, 5, etc. In some of the bottles they have up to the 7. So in digital devices, they measure it into the ml per minute, per minute. How much of the air is leaking in 1 minute? So it is said that if the machine says that the air leakage is less than 50 ml per minute, then you can even remove the chest drain. So it is very convenient from the patient point of view. Because what we do now, if the air leakage is there, we either do not remove the chest drain, or if it is the prolonged air leakage but the lung is expanded, then what we practice, we clamp and wait for 24 hours against it. So any extra day, any additional day of chest drainage system remaining inside the body of the patient is painful for him, and also an extra care is required. So those things can be avoided in the digital system. Only the disadvantage is, I think it costs not less than 20 or 25,000 Nepalese rupees, maybe higher, more than that. The good thing is that it has two parts. One is the reusable part, where the motorized device, I mean the battery, it can be recharged, one, and then there is the container, like the bottle. So the container is the disposable, where the drainage comes. It is attached with the motorized digital device, and that becomes the single unit. So the main thing, the main part, the main body of the system remains the same for many years. I think you can use it. Only containers have to be changed, but it's expensive. Kati parcha I don't know. I have seen only in abroad where it's not being practiced. I think in Nepal. 16 pounds. So it is very expensive. But I think it's a very good device if somebody can afford. So summarizing the take-home message should be that it's a very simple thing. Everybody of us is knowing about using it, but practically the very nuances, the common small nuances have been mentioned today by him, by Dr. Ashish. I think it's very good education even for the nurses and for us. So the only thing is, we should keep in mind that at least the suction system is the best for any patient undergoing thoracic surgery, that the money is not spent twice. If we use only simple bottle, then we may require the suction device, then you have to again purchase the 3-bottle system. So it's good that if we ask the patient to bring the 3-bottle system from the beginning. If we have the option of the dry and wet, I think the preference should be the dry drainage. It's very convenient. You don't listen the noise like in bubbling in the wet system. It's nothing there. Only disadvantage is said very rightly that if the very thick fluid, very thick plus or the blood clot, then it may block the valve system inside the dry system. So that is, I think, that is the disadvantage of that one. Or okay, question, comments? Sinapi Malala